Hi everyone, today I'm going to discuss prepubertal vaginal bleeding, and that means bleeding from the vagina before puberty develops. And you may recall from my previous videos that we don't expect any signs of puberty in girls before age 8, and we don't expect the first period or any bleeding before the age of 9. Now, there are several causes for bleeding before puberty, many of which are not of great concern, but there are a couple that are extremely serious, and that is why we take this condition very seriously. And we encourage parents to bring their daughters along if they see any bleeding before the expected time. So, what should you expect if you took your daughter along with a history of bleeding before puberty? Well, as with everything else in medicine, what you'd expect is that we will ask certain questions, we will get the story of the circumstances around the bleeding, and we will get the story of your child's development up to that point. Following that, we do a physical examination of the child, looking for signs of pubertal development, such as breast development, such as hair development, and we would also have a look at the vulva. Now, be reassured that we would look at the vulva, we would look at the hymen, but we would not do any sort of internal examination at this age while the child is awake in clinic. And I've discussed this before, and that's because the hymen is extremely painful before puberty, and that would possibly traumatize this child and turn her against being examined in the future, having smear tests in the future, etc. So it would be an external examination. So the investigations we do are pretty standard, and the idea is that the investigations look to rule out or rule in the various causes of bleeding before puberty. So what investigations would we want to do? After the history and examination are performed, then we would most likely like to do blood tests to look for hormones, imaging in terms of an ultrasound scan, and this is a jelly scan on the outside on the tummy to look at the womb, the lining of the womb, the ovaries. And we would most likely want to have a look into the vagina via a vaginoscopy, and that is a camera test into the vagina, and that is done under general anesthetic because, as I mentioned before, it would be quite painful to be done awake. In terms of blood tests, we do the female hormones such as estrogen, and we also do the brain hormones that influence the ovaries that I've discussed in a previous podcast. To see if they're elevated or if they're at the levels we expect before puberty. We also do thyroid hormones because an abnormality of thyroid hormones can also sometimes trigger some vaginal bleeding. If we find that any of these hormones are abnormal, that would usually trigger a referral to a pediatric endocrinologist who would then take over the care or share the care between pediatric endocrinology and pediatric gynecology. So the first cause that I'll discuss is precocious puberty, and that means pubertal development before we expect it, and that can cause vaginal bleeding. It would also cause, because the bleeding in this instance is hormonal, the hormones have other impacts around the body. For example, we would look for signs of pubertal changes in the breast development, hair growth under the arms or on the vulva, growth spurt, and these are all signs of puberty. The blood test that we do would give us an indication of whether the hormones are what we'd expect for a young child or what we'd expect in a child who is experiencing puberty. Other tests that may be performed may be an X-ray for bone age, and these girls, generally speaking, with precocious puberty, if seen by a pediatric gynecologist like myself, I would refer these children on to a pediatric endocrinologist for further management. Sometimes girls may have developed an ovarian cyst or an ovarian tumor, which can produce hormones. And that's where the ultrasound scan comes in. And that is why we look at the ovaries to make sure that the ovaries still look inactive as we'd expect before puberty. The next possibility is that of a foreign body. So, a foreign body is any item or article that may find its way into the vagina. It may either be placed there or it may find its way into the vagina, and that usually causes vaginal discharge. And I discussed this in my previous podcast about vaginal discharge in children. But the vaginal discharge caused by a foreign body, it is almost always blood-stained. So a foreign body is more likely, rather than cause fresh blood, to cause a blood-stained vaginal discharge. However, depending on the foreign body, it can cause fresh bleeding. So it's really, really important that we rule out a foreign body as the cause of prepubertal vaginal bleeding. The most common foreign body is actually a bit of toilet paper that's found its way up into the vagina on wiping. That can cause irritation of the vaginal walls and bleeding or discharge. Looking for a foreign body entails doing a vaginoscopy or camera test into the vagina under general anesthetic because, as I mentioned, the most common foreign body is a piece of toilet paper, and we would be unable to see this on any form of imaging that we tried. So, in order to completely investigate the child, we would need to do this procedure where we have a look into the vagina. There are other things we're looking for when we're looking into the vagina as well. So there may be rarely polyps or little skin tags of the vagina that can cause bleeding. There can be what we call hemangiomas, which is a conglomeration of blood vessels in the vagina. That is quite rare, but they can bleed. And most importantly, the most important reason that we do the vaginoscopy is to rule out cancer. There is a very serious tumor called a vaginal rhabdomyosarcoma that starts in the vagina. It can involve the bladder or the urethra, which is a tube that passes wee from the bladder. It can involve the cervix and the uterus. The scary thing is that this tumor almost always occurs in children who are less than 5 years old, and the peak age is around the age of 2 years old. So, any child who has abnormal bleeding, it should not be ignored because the child is so young. In fact, this is the highest risk group. We do know that young babies can have a small withdrawal bleed soon after birth, and this is within the first 2 or so weeks after birth, and they can have a little bit of bleeding, like a little bit of a period, and this is common knowledge. But once that very early time has passed, so the first 2 to 4 weeks, once that has passed, then any bleeding after that should be treated as abnormal and suspicious and should be investigated appropriately. The next cause that I will discuss is that of trauma. So, the trauma that we usually see in girls is usually what we call a straddle injury. And a straddle injury means that the girl has fallen with her 2 legs on either side of an object. And that is quite often the bar of a bicycle, or it may be monkey bars, or a bench, or a piece of furniture. Straddle injury is what we expect. There may be some bleeding, but we'd also expect bruising of the vulva. And usually the bruising is more prominent on one side. So it tends to be asymmetrical, more prominent on one side because it's difficult to fall exactly in the center on an object. Straddle injuries in general do not cause any internal injuries. It's usually on the vulva because the soft flesh of the vulva, because it hits a hard object, it's compressed against the bone of the pelvis, and that's what causes the injury. Penetrating trauma is more rare, and that can occur perhaps in a road traffic accident, or it can occur with a fall onto an elongated object rather than a bar like object. And penetrating trauma, as you can imagine, is potentially more serious. It may involve not only the vagina, it may involve the bladder, it may involve the rectum or the last bit of the bowel. So that needs to be seen in hospital, and surgical management may be necessary to rule out any other injury. Now, when we talk about trauma, there is always the risk that this is a non accidental injury. That is, it wasn't fall upon a bike, it wasn't an accident, but this injury was done intentionally. And along those lines as well, of course, we also have to consider the possibility of child sexual abuse. For this reason, the child is examined. We look at the vulva, we look at the hymen, and we take a really careful history to ensure that the findings that we see on examination tally up with the story that was given as to how the injury occurred. Also important is when the injury occurred, where the injury occurred, who was there. So, for example, if the injury occurred in school on a playground in front of, you know, teachers and other students, then obviously this story tallies. Otherwise, we just have to be really careful. And we are really careful and we are really specific, and we may ask many questions because a big part of our job is protecting children. And I'm sure parents would want it no other way that their children are adequately protected and safeguarded. With non accidental injuries, there may be other telltale signs that something else is going on rather than just an issue local to the vulva or the vagina, such as bruising or fractures. And therefore, that's where a full physical examination is important to rule out these things. The other causes of bleeding before puberty sometimes involve bleeding not actually from the vagina or higher up, but bleeding from the vulva. So there are certain vulval skin conditions like lichen sclerosis, which can cause itching, and it can cause the skin to be quite delicate, and you can have bleeding from the skin due to itching. But this is usually obvious because you can see the itch marks and you can see the skin changes of lichen sclerosis. Having said that, if there's any uncertainty, if it is not clear that the bleeding came from the itching, then we go back and we investigate this as we would any prepubertal vaginal bleeding. Some infections, such as vulvovaginitis, can cause bleeding, but again, the effect is more likely to be discharge rather than bleeding. And again, if there is vaginal bleeding in a child who has vulvovaginitis, we do not assume that it is due to the vulvovaginitis. We do the full investigations to make sure we're not missing anything. Because, as I said, one of the causes is cancer, and that is something that we absolutely would never want to miss. The last thing to say is that sometimes it can be a bit difficult to determine exactly where the bleeding has come from, especially in young children. So, particularly if children are still in nappies, then it may be that the bleeding is from the bladder, or it may be that the bleeding is from the bowel or the bottom. Sometimes this is difficult to determine, but we always have to keep these in mind as a possible cause for the bleeding. In particular, there is a condition called urethral prolapse where the delicate lining of the inside of the pipe that leaves from the blood and takes wee from the bladder to the outside can be pushed outside a bit, and that results in this delicate tissue on the outside that bleeds quite easily. So this again, we are looking at examination to rule out whether the child has a urethral prolapse. So those are the main causes for bleeding before puberty. And although most of them, and indeed the commoner causes, are quite benign, meaning that they don't usually have any long-term consequences and they're not that serious, there are several causes such as tumors of the ovary and tumors of the vagina that must be picked up early because, of course, the earlier we diagnose these conditions, the better the outcome. So if your child has bleeding before puberty, before it's expected, even if it's just on one occasion, please take her along to her doctor to be seen, examined, and referred as necessary. If you enjoyed this video, please like the video, subscribe to my channel for more valuable information about pediatric and adolescent gynecology. Please share your experiences with us. Feel free to comment on the video below because we can all learn from each other. And finally, why don't you join us at my Facebook group, Gynecology Girl Talk, where again we discuss all things pediatric and adolescent gynecology. Thanks for watching.